Dogs' superior sense of smell has long been harnessed to help humans avoid danger, and that ability is becoming increasingly used in medical tests, the latest application being the detection of colon cancer. In a Japanese study, a Labrador retriever sniffed out the disease in stool so accurately that the dog's diagnosis almost always matched that of a colonoscopy drive. Hideto Sonoda, of Fukuoka Dental College Hospital in Fukuoka, Japan, and colleagues reported in the journal Gut. The results are a first step toward a means of developing an early detection system for colon cancer, the researchers said. The work isn't a surprise to many researchers, as dogs have been sniffing out a host of conditions related diagnosing colorectal cancer. Dogs have been helping owners with diabetes to sense through smelling breath times when blood sugar levels are low, and encouraging owners to check their blood sugar and treat themselves, said Dr. Rebecca Johnson, of the University of Missouri and director of the Research Center for Human-Animal Interactions. They've also been used as service dogs for seizure patients, with the ability to detect subtle behavioral changes and pheromone changes before patients begin convulsing, Johnson said. They have so many million sensor cells in their noses that send messages to their brain, so many more than humans do, she added. With regard to cancer, researchers have started looking at canine sniff tests for melanoma, as well as bladder, lung, breast, and ovarian cancer. So the researchers decided to look at dogs' detection power in colorectal cancer as well. They took breath and stool samples from colorectal cancer patients at a hospital in Japan and compared them with those of healthy controls. They surmised that it might be easier for dogs to detect cancer in the stool samples, which were watery because they were collected during colonoscopy, since they were taken from nearer to the cancer. But the cancer scent might also have been masked by various other scents in feces, including short-chain fatty acids and sulfides, the researchers said. There were a total of 33 cancer breath samples and 37 cancer stool samples, which were placed in groups with samples from 4 healthy controls. The Labrador retriever, trained in scent detection of cancer, smelled each sample group and sat down in front of the sample in which it detected the scent of cancer. Compared with colonoscopy, the researchers found that the dogs detected colon cancer in patients' breath with a 91% sensitivity and a 99% specificity. But the results were even better for stool samples. The dog detected cancer with a sensitivity of 97% and a specificity of 99%, and accuracy was high even for early cancer, the researchers said. In further analyses, they found that the results weren't confounded by current smoking, benign colorectal disease, or inflammatory disease related about colon cancer genetic testing, but the researchers cautioned that it may be difficult to introduce canine scent judgment into clinical practice, given the expense and time required for the dog trainer and for dog education. They also warned that scent ability and concentration vary between different dogs, and also within the same dog on different days. And dogs can only perform those tests for a maximum of 10 years, they added. Still, Johnson, who was not involved in the study, said the test could be cost-effective. We are always looking for effective and inexpensive screening devices, she said. Training dogs is not inexpensive, but the cost to the end user is going to be a lot less than many of the tests we have. It wouldn't be diagnostic though, it would be a screening test used in combinations with other tools, Sonoda and colleagues said. Future studies should look at cancer-specific volatile organic compounds, the substances the dogs detect in the cancer samples, to develop new methods for early detection of colorectal cancer. Learn more in our Colon Cancer Center.